Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Yes, we're back. We have other things to talk about besides prostate cancer, but prostate cancer is always interesting because so many men are affected and families are affected. So I want to talk about some other topics today.
If you have any questions, why don't you give us a call here at the studio? The number is 1-800-848-9222. Again, 800-848-WABC, 9222.
I think most people are bashful to call.
I think so too, Doc.
I get a lot more calls during the week.
That's okay.
Anyway, we had a gentleman who came, and I told him I'm going to talk about him today. He's a very nice man, businessman, worked for a science company, and very fair-complected. So he came, his wife came, his daughter came, beautiful blonde with blue eyes, and had a very extensive squamous cancer of the skin. And we actually treat a lot of skin cancers. In certain parts of the world, it's an epidemic. And in the United States, people have more leisure time and probably more time to get sun exposure.
Right.
Although he and his family said he always wore a hat and had sun protection. Most people's sun damage is actually before the age of 18. When we're little kids, we're running around, and
right.
Then afterwards we get smarter and wear hats and sunscreen, but the skin remembers.
Right, you forget, but the skin remembers.
You forget, but the skin remembers.
Certainly.
So this man had a very extensive squamous cancer of the right forehead area going in the hairline. He had attempted surgery. So right through the middle of this tumor, if you can imagine a tumor the size of almost like your palm, and the surgeon cut through it, and I guess saw that he couldn't remove it all because there wasn't enough skin to close it. Your skin on the forehead is pretty tight.
Sure.
So he opened it and closed it, and the patient came to us, and we're proceeding with hyperthermia. Hyperthermia is heat treatment. It's been known since time of Cleopatra to help cure cancer or treat cancer. And we're using external radiation, and he's getting a series of treatments of hyperthermia and radiation for his squamous cancer of the forehead. And we treat a lot of cancers of the skin, especially around the eyes, nose, mouth, and ears.
Sure. Because,
number one, radiation is very effective, and number two, it helps prevent damage to the healthy tissues as far as the topography, so there's not distortion usually of the skin. So radiation is a very nice way of treating skin cancers. We use radiosurgery, which is very focused, so we're able to aim the beam at the cancer. And sometimes we'll use hyperthermia also to try to enhance the effects. We're one of the few centers in America that has hyperthermia equipment. We have a couple calls. We're going to take first one from Robert, who's from Whitestone. Good morning, Robert. Good morning, Robert. Can you hear me? Okay, I can't hear you. So let's go to Dr. Eisen.
Hello?
Hi, this is Robert.
Hey, Robert.
Hi, can you speak up? I can barely hear you.
Okay, I think we have a bad connection. I'll speak
probably
as loud as I can. I have a question. I was diagnosed with prostate cancer early in May. I had the radiation treatments. I went for my first follow-up yesterday with the radiation oncologist, and he said the way he's going to track the illness is by a relative decline in the PSA. My PSA was anywhere from 28 to 41 initially. I had a Gleason score of 6 with 3 of 12 cores positive.
And your PSA was how high at the maximum?
41, and then it dropped to, this is before treatment, it bounced between 28 and 35.
And what did you have, like 45 external beam treatments?
No, I had 5 of the gamma knife treatments.
Well, it's not gamma knife, because gamma knife
is cyberknife.
Yeah.
I had 5 of those, and now my prostate obviously is still there, and it's large. It's 90 grams, and I questioned the oncologist and said, since the gland is intact, would it not be putting out a lot of antigen and giving an elevated PSA? And what he told me was what he would judge is by the relative decline over the course.
Well, I tell you, number one, thanks for your call, and I appreciate it very much. Number one, you're at very high risk. With a PSA of 40, you're at very high risk. Most doctors would add in hormonal treatment, most doctors will consider CyberKnife treatment. I assume you were treated with a CyberKnife, experimental in your case. Probably the best treatment for high-risk prostate cancer, and I think you are very high risk because of the PSA of 40, would be brachytherapy plus a form of radiation. And you may wish to consider brachytherapy and hormonal therapy in your case because of your very high PSA.
There might be a little misunderstanding. I have been treated.
I understand that.
Okay.
I understand that, but
So
I'm just telling you, your treatment most likely is inadequate. So that's the problem is you need to know all the options and make the right decision to begin with. CyberKnife treatment for prostate cancer is usually considered experimental. It's probably not the best treatment for high-risk prostate cancer. With a PSA of 40, you're at very high risk for recurrence. I think there's things to do in your case. Following the PSA may not be the best thing in your case because you have such a high risk. But I'm happy to talk to you. You can call us at the office, and I'd be happy to speak to you at greater length. Our number is 212-CHOICES, 212-246-4237. And call me during the week, and I'd be happy to answer more questions for you. So thank you for calling.
Thanks for calling, Robert.
We have Dr. Eisen on the phone. Dr. Eisen is a Argentinian-born and educated radiation oncologist. He's a very equipped radiation oncologist. He trained at Columbia Medical School in radiation oncology, and he's devoted his life to taking care of the Spanish patients with cancer problems to be able to communicate with Spanish-speaking patients and offer the best possible treatment. So good morning, Dr. Eisen. Buenos dias.
Buenos dias. Good morning.
Good morning, Dr. Eisen. How are you?
Good. How are you?
Fine.
Great. Thank
What do you
you.
have to tell our listeners today?
I would like to give a little message to the Spanish community so they will be able to get more information in their own language.
What's that message?
Okay, well, I just want to tell in Spanish that para el tratamiento del cáncer, la mayoría prefiere que sea efectivo, no invasivo, bien tolerado y ambulatorio. En Radiocirugía New York, que es la pionera en radiocirugía.
Dr. Eisen, why don't you tell us in English, because most of our listeners are...
Okay, so I want to tell them that the way that we are doing it in our center is in their own language. We go over all the situation that they have. We work on all the previous information, and we do get all the information that they need, pathology or x-rays if they cannot get it.
What kind of diseases do you treat?
Well, probably lately more and more we are moving into not only primary tumors, but also patients that they have an issue with previous treatments that they are coming to us because they have a recurrence or they are coming for a second opinion, which actually is extremely important because they have a chance to take a look at the whole situation.
So do you treat then, for example, if you have a lung cancer or liver cancer or kidney cancer, the primary or the metastasis?
Absolutely.
And what's your success rate for those?
Well, usually when we target, for example, recently on patients that they have a metastasis and we focus the radiation using radiosurgery, 5 treatments, the control of the tumor of the metastasis is close to 90%, and also the pain control, if it's in a situation that the tumor is pressing in some areas or is creating pain on the bone, is excellent. It's the patients immediately after like a week.
That's all with radiosurgery. So it's a non-invasive method of treatment, outpatient.
Exactly. It's outpatient. That's very important because many times patients, they live with a family and they're very concerned about getting into a hospital. And I always tell them, no, you can get it outpatient. We are in the center of the island. We are in 38 and Broadway.
Which island? We're the center of Manhattan. It's the center of the world.
It's the center of the world.
So how do people find you? How can they call you day or night?
Well, definitely. They can call me 24/7.
So what's your phone number?
917-836-8105. And
what's that number? Do you have it in Spanish for your Spanish
for the Spanish community, 917, so it's 917-836-8105. 917-8105.
Okay, can you give it one more time before we end
Sure.
the show?
917-836-8105.
All right, thank you. So people should feel free to call you anytime? Is that fair enough to say?
Absolutely, 24/7. I do enjoy, and also they can come to our place. They can call the front desk. We'll get an appointment, and we'll be able to go over the whole situation.
All right, thank you very much, and have a nice weekend.
Thank you.
Thanks, Dr.
Okay,
Eisen.
bye-bye now.
Bye-bye.
So that's Dr. Eisen, who takes care of Spanish-speaking patients in their own language who have cancer. So you can feel free to call him at the number he gave you or our own office number. We also had several other interesting patients that came back. We have one patient who's about a 65-year-old man with gastric cancer. He went to a surgeon after he had bleeding and pain. He was found to have gastric cancer. His biopsy showed gastric cancer. He had attempted surgery at one of the big hospitals in Manhattan, and it was unresectable. The cancer was growing through the wall of the stomach into the adjacent tissues. And we treated this man with radiosurgery, did a course of radiosurgery, and we get a follow-up PET scan. A PET scan is an injection of radioactive material to see exactly where the cancer is.
Okay.
So initially we did a PET scan which showed the cancer growing through the wall of the stomach. We then did another PET scan after the completion of therapy, and the cancer was gone away.
Good news.
Gone away.
Good news.
So he went back to the surgeon. We sent him back to the surgeon, and the surgeon was shocked. He's about a 60-year-old surgeon, very prominent. He said never in his life had he seen a gastric cancer go away with radiation like he did with our radiosurgery.
And this was after seeing you, doctor, correct?
We treated him,
Right,
yes.
right.
I don't want to toot my own horn, but yeah, we treated him, and he had really no complications during surgery. He did great, and the follow-up PET scan showed the cancer went away. So it's really very good news for him, and I was very happy for him. But another man with a skin cancer on his cheek. He's actually a diplomat. He's an ambassador for the State Department. He's traveled around the world, and he has a keratoid canthoma of his skin, and the surgeons wanted to do radical surgery. And he came to us. He heard about non-invasive treatment, especially to try to keep his face intact.
Sure, he's probably in the light, if you will.
Right. So
often.
when you meet someone, the first thing you see is their face.
Yeah, sure.
And he didn't want to have a deformed face, so he's just started treatment yesterday, and we'll report back on him. But
keep
most
us
likely he's
updated
gonna
on
be
that.
okay.
Good.
We have another interesting case: a man who has kidney cancer and metastasis to the lung and to the brain. Now, the brain we gave radiosurgery to, fractionated radiosurgery, so it's non-invasive treatment for brain metastasis. Kidney cancer was always thought to be radio-resistant, that it would resist radiation. So this man had radiosurgery for his brain metastasis. They all went away.
Wow.
Now he had the chemo Sutin for the lung metastasis.
Yep.
And the cancer grew. So it's a very nice comparison. Radiosurgery for kidney cancer went away. Sutin for kidney cancer, the cancer grew. And actually, Sutin only works for about 30% of people for about 6 months.
The more traditional approach was less effective.
The more traditional approach, chemo, didn't work. So it's just a sign for kidney cancer and other cancers. You may want to think about radiosurgery, even if the other surgery, radiation, or chemo hasn't worked. Unfortunately, the hour's almost over, so feel free to call us at our office number, which is 212-CHOICES, 212-CHOICES. We have a free booklet and DVD to send to you. Just give us your name and address. We thank you for tuning in. And again, call us at 212-CHOICES to have all your questions answered in private or in person.
Have a great
Thank
Thanks
you.
for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week,